Everyone, my name is Bryson Watts.
My name's Zach Tongate.
I'm Jennifer Nguyen.
And I'm Paige Hagey. So our project, we researched the effects of telehealth on mental health during the COVID-19 pandemic, which has now passed the 1-year mark. In 2 surveys done by the National Center for Health Statistics from January of 2019 to February of 2021, it has shown that the rates of anxiety and depression have gone up by over 30%. Due to all the shutdowns and social distancing that went on during the pandemic, in-person care has been difficult, which has led to the use of telemedicine to continue receiving healthcare. Our question then became, does the implementation of telehealth visits since the beginning of the COVID-19 pandemic affect the mental health of people aged 13 to 25?
For our methods of research, we were able to utilize the CINAHL database from the Cumberland University Vice Library website to help find supportive studies to answer our PICO question. We also use Roy's theory of adaptation to help guide our research. Roy's theory of adaptation focuses on the individual's ability to adapt and cope with various situations. In this case, COVID-19 and quarantine. The COVID-19 pandemic has led to increased social isolation as well as deprivation of many essential mental and physical health resources. That being said, these adolescents had to adapt to new guidelines and find helpful resources like telehealth.
While the physical impact of COVID-19 cannot be underestimated, the psychological impact that it's had as well has to be recognized. Telehealth, or more specifically telemental health, may be a way to help combat that. It may be able to play a vital role in the care of these mental health patients while we continue to deal with this pandemic and the lockdown and the mental issues that are associated with it. Obviously, people aren't able to have as much in-person interaction as they have, therefore care may not be as great. So the use of telehealth or telemental health may be able to provide a therapeutic solution for that. And us as nurses may not be able to do as much, but one thing we can do is encourage patients and stress the importance of using telehealth as an alternative to get the needed mental health care that they need.
For our results, we found 5 research studies that showed that telehealth was either used more during COVID-19 or that telehealth had a positive impact on mental health. For our first 2 by Lay and Falcone, they showed that there were increased rates of anxiety and depression during COVID-19, but when used with telehealth, there were decreased symptoms. With our third source by Chen, they focused on breast cancer patients, but it showed that when breast cancer patients included telehealth in their care, they had higher rates of self-efficacy scores, less depression symptoms, less distress, and less anxiety. For our resource by Wu, this focused on diabetes patients, and it showed that implementing telehealth helped them promote healthy eating habits and appropriate exercises into their daily life. For our last source by Bate, the users of telehealth reported that telemedicine and telehealth was more preferred than going to in-person visits, like to the doctor. So in conclusion, due to the COVID-19 pandemic limiting social interaction and causing quarantining and less in-person visits, maintaining continuous care for mental health patients is specifically important. Telehealth and telemedicine are able to provide efficient treatment, ongoing care, and an improvement in mental health systems, as shown in the research study that focused on breast cancer patients. Although we were unable to find studies that specifically focused on adolescents and young adults, these results with our other studies can also be applied to the individuals during COVID-19. We will also still need more research to understand the full impact of telehealth on patient outcomes, but having the opportunity to continue treatment via online video, phone, or chat, this allows patients to minimize their symptoms of anxiety and depression and have a better quality of life.